Hi JD, my name is Christine. I'm going to be going over some discharge instructions with you on medication with you and your wife. The first one I'm going to go through is Synthroid. You currently take 100 micrograms by mouth daily. This is used to add thyroid hormone to the body. Do not run out of this medication. Make sure you're checking your blood sugar. This does affect how the body controls blood sugar. May also cause weak bones or osteoporosis that with doses that are too high, and this medication can also affect fertility. Make sure that you call your doctor right away if you are having signs of an allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin. Signs of high blood pressure, chest pain or pressure, shortness of breath, headache, feeling weak or tired. If you miss a dose on this one, take a missed dose as soon as you think about it. If it's close to the time for your next dose, skip the missed dose and go back to your normal time. Do not take 2 doses at the same time. The next one we're going to go over is Protonix. You currently take 40 milligrams by mouth daily. Make sure with this medication you are not crushing, chewing, or breaking this one open. You can take it with or without food. This is used to treat GERD or acid reflux. The brand name is Protonix. The generic name is Pantoprazole. Make sure you let your doctor know if you are allergic to this, if you have throat pain, chest pain, very bad belly pain, trouble swallowing, or signs of a bleeding ulcer like black, tarry, or bloody stools. If you're throwing up blood or throw up that looks like coffee grounds, maybe a sign of a worsening health problem, make sure you contact your physician right away. This can increase the chance of a hip, spine, or wrist fracture with people with weaker bones. You can also have lower magnesium levels if you've been taking it for 3 months or more. The risk of stomach ulcers or polyps may be higher in people that have been taking this for more than a year. Make sure you notify your physician right away if you have bone pain, fever. This also can increase the risk of C. diff. It is really bad diarrhea, a severe form of diarrhea. Make sure you let your doctor know that if you do end up with severe diarrhea, it can cause diarrhea. It can cause upset stomach or throwing up, gas, joint pain, and signs of a common cold. But if you are experiencing severe diarrhea, make sure you let your doctor know. If you take a dose or if you miss a dose, as soon as you think about it, go ahead and take it. If it's too close to time for the next dose, go ahead and skip it and take the next dose in the morning. The next medication is new to you. It's Lopressor. You're going to be taking 50 milligrams by mouth daily. The other name for it could be metoprolol. This is to help control your heart rate and your blood pressure. If you have a sulfa allergy, make sure you let your physician know. If you have asthma or other breathing problems like COPD, if you're not able to pass urine, please notify your provider right away. Avoid driving or operating heavy machinery until you know how this drug affects you. Make sure you're checking your blood pressure and heart rate before you take this medication. Make sure you talk with your doctor before using alcohol, marijuana, or other forms of cannabis or prescription or over-the-counter medications that may slow your actions, as this can have a snowball effect. Do not stop taking this all of a sudden. Make sure you continue to take it. If you're experiencing signs or symptoms of a reaction, make sure you let the doctor know. If you're having signs of high blood sugar, like feeling sleepy, unusual thirst or hunger, passing urine more often, flushing, fast breathing, or breath that smells like fruit, make sure you let your doctor know right away. Any kind of chest pain that is new or worse, or unable to keep or get an erection, make sure you let your primary care provider know as soon as possible. Make sure you're drinking lots of fluids with this medication. The next medication you've been prescribed is Zestril, 10 milligrams by mouth daily. It's also called Lisinopril. This is used to treat high blood pressure. It is also used to treat heart failure. If you've ever had a reaction called angioedema, which is swelling of the hands, face, lips, eyes, tongue, or throat, trouble breathing, trouble swallowing, or unusual hoarseness, make sure you let your physician know. If you've ever had any kidney issues, also let your physician know this may not be appropriate for you to take if you've had any of those issues. Make sure you rise slowly if you've been sitting or lying down. Talk with your doctor before using any over-the-counter medications like cold meds, diet medications, stimulants, NSAIDs like ibuprofen or naproxen or Aleve, and some natural products or aids like melatonin, things like that. Make sure you let your doctors know any over-the-counter, even supplements or herbal remedies you use. They may be contraindicated or you may not be able to take them while taking this medication. Make sure, again, to talk with your doctor if you are drinking alcohol, as it can have an adverse, not a great reaction with this. Make sure, again, you are drinking lots of fluids. Signs of any kidney issues like inability to pass urine, signs of high potassium like a heartbeat that does not feel normal, or feeling confused, weak, lightheaded, or dizzy, a cough that does not go away, chest pain or pressure. Make sure you are notifying your physician right away that you are experiencing these problems. This medication is best taken with lots of water, non-caffeinated liquids. The next one we're going to go through is metformin. This, you are going to take 500 milligrams by mouth daily. This medication is used to help lower blood sugar in patients with diabetes. Make sure you let your doctor know if you have recently had a heart attack or stroke. If you're not able to eat or drink like normal, including before procedures or surgery, you need to make sure that you let, if you're ever going to go in for something using contrast dye, you need to make sure that you let them know, because you will probably have to stop this medication for 48 hours prior to that, but make sure you let your physicians know that you're taking this medication so they can give you further instructions. While you're taking this, make sure you do not drive if your blood sugars have been low. Make sure you check your blood sugars as you have been told by the physician. If it's hard to control blood sugars, to discuss it with your doctor. It may also be harder to control blood sugars during times of stress, such as fever, infection, injury, or surgeries. A change in physical activity or exercise may also affect your blood sugars. Make sure that you eat like a carbohydrate snack, some kind of snack and protein before you work out. You don't want your sugars to drop when you're out, in the middle of a workout and then you start to feel dizzy. Make sure you follow a diet and workout plan that your doctor has told you about. Make sure you are careful in hot weather while being active. Drink lots of fluid to stop fluid loss. Long-term treatment with metformin can lead to low vitamin B12 levels. If you've ever had vitamin B12 levels that are low, make sure you talk with your doctor. If you experience stomach problems like upset stomach, throwing up, or diarrhea when you start taking this medication, make sure you call your doctor right away. If you've had stomach problems later during treatment, call your doctor right away. Make sure you take this with meals. Best probably to take it with breakfast. If you miss a dose, make sure you just skip the dose and don't double dose yourself. Avoid taking 2 doses at the same time. And that is the medication information. I'm going to give you all of these papers. I've highlighted some pointers. I went through most of them. I did not go through all of them, but this is going to be for you to take home with you. And if you have any questions, feel free to ask, or you can give us a call back. I hope the best for you. Thank you.